Most people are doing the cold plunges wrong and don't even realize it. People are chasing intensity instead of adaptation, and that's an issue. Cold exposure is good for managing inflammation, pain, soreness. It's good for waking you up, but it is most effective for building resilience. And it works because it widens something called your window of tolerance. Above this optimal window, you get fight or flight. You get reactive, you start snapping at people, you get anxious, you get frantic. And below it, you start shutting down. You go numb, you avoid, you check out. And in this middle zone, that is where we thrive. We stay calm and clear and capable. We're able to roll with the punches and deal with the stress and keep making good decisions despite the stress. The thing about this window is that it is trainable. And just like when you get shitty sleep and then you have no tolerance for idiots, and then when you get better sleep, suddenly you can handle more idiots, we can influence this window. Cold exposure is supposed to be a safe, short stressor. You get in, your stress levels spike, and your job is to stay present and to stay calm. Slow, controlled breaths in through the nose, out through the mouth. You're trying to train your nervous system to stay calm in the storm. Not to build tension, not to grit it out in a panic when things aren't going well. Anyone who's done cold plunges intuitively knows some of these moments. In your first few breaths, when you first get in, your body screams at you, I want out. And then something shifts. You settle in and you sort of tell yourself, oh, I'm okay, I can do this. That is your nervous system recognizing that stress doesn't automatically mean danger. And just think about it logically. When you push yourself so hard that you come out screaming and shaking, like in a panic, what are you training your body to do in difficult situations? And I know what people are going to say when they hear this. Oh, I've been doing this for a while. I'm cold adapted. I need more. Maybe. But for most people, pushing past 3 minutes is pushing past the point of diminishing returns. The juice is not worth the squeeze. I'm sure if you've been doing this for a while, you know people that have done this, and what happens? You catch a cold, you fall sick, you wreck your immune system, you're tired for the rest of the day. What's happening there? Your CNS is fucking fried. And then they go around telling everybody, oh, cold plunges aren't good for you. They're not good for me. I get sick every time I do it. And I get that you want to build more resilience. But hammering the fuck out of this one tool, which is all it is, by the way, it's just one tool, you're not doing it justice at all. In the next video, I'm going to break down a couple of other levers that actually build long-term resilience that go really well with your cold plunges.